All right. Hi, everyone. We're going to talk about chapter one today. This is my first time recording, doing one of these kind of flipped classrooms with the lectures pre-recorded. So hopefully they'll get better as we go. But in the meantime, we'll just suffer together. All right. So chapter one talks about what is counseling and who is the counselor. So hopefully you have a good idea of kind of what you've gotten yourself into at this point. But just to kind of set the tone, I want you to be thinking about what do you imagine when you hear the word counselor? Like, what does a counselor do on a day-to-day basis, whether that be clinical mental health or school counseling? But that is what is at the forefront of our mind. What is counseling and what is it not? How is it different from the other helping professions? Okay. All right. All right, so guidance counseling and psychotherapy, are they just variations on the same theme? So guidance is, we refer to that as advice, direction on the surface, advocacy, and support. It first appeared in the 1600s, and it was defined as the process of guiding an individual. So counseling is really that this idea has really been around since the 1600s. The early work involved getting moralistic and direct advice, meaning there's a kind of a power differential. Someone knows better than you, and they're going to give you the advice to do better for yourself. That's not so much what we do anymore, but this is just kind of where it started. It's later used by vocational guidance counselors to describe the act of guiding a person into a profession or offering suggestions for life skills. And we'll get more into this when we talk about the history of counseling. But counseling was really born at the turn of the century during the Industrial Revolution when the country was largely, an agricultural society, and we had to transition to a more industrialized version of society. And people really had never encountered that and needed some guidance on that. And so that's kind of how counseling was born, but we'll get into that more in chapter four, I think it is. So counseling is more now considered a short-term, facilitative, here and now, change, problem solving, being heard, awareness, self-awareness, awareness of your impact on others, things like that. Adopted by vocational guidance counselors dissatisfied with heavy moralistic and advice giving implications on guidance. So it's very important that you understand our job is not to give advice because we don't know better than our clients. Our clients are the experts on their own life. And so it would be very narcissistic to think that we know better and that we could tell them how to live their life. It's just not what we do. And it actually can cause harm because if you give advice and then it doesn't work out, it might work for you. You might do that, whatever the advice is. But if they apply it to their own life and it doesn't work out, where does that leave the client, right? So we don't give advice. Often counseling is used interchangeably with psychotherapy, but there's no really official psychotherapy profession, and we'll get into that here in a second. So, psychotherapy, when you think about this, is kind of considered the deep, dark, secretive, sexual, unconscious pain, hidden long term, reconstructive. Think Freud laying on the couch, psychoanalyzing, right? It comes from the Greek word psyche, which means spirit or soul, and whatever this therapeutos, caring for another. So psychotherapy. But even still, when I fill out my notes, I'm in private practice, there's a spot for psychotherapy notes. And so you've got your official notes for the insurance, and then you've got your kind of your process notes. And so they're called psychotherapy notes. So we still use this word, but there's no official psychotherapy profession like there is counseling, social work, psychology, psychiatry, those kind of things. So, regardless of which term is used, a number of different professionals practice it. Despite differences in training, the duties of mental health professionals have begun to overlap. So clients really don't care kind of what your title is or what your professional identity is, but it's important that you know what your professional identity is. So what one does, guidance, counseling, or psychotherapy, it's often based on where you work, the helper's inclination, and how you're trained. And so we're really training you as counselors in this program. And textbooks don't typically distinguish between counseling theory and theories of psychotherapy, but the theories that you'll learn in the semester, they're going to be counseling theories, right? And you'll learn about that with, I think, Dr. King is teaching you that. So. ACA's definition of counseling. This you will see again. You will need to know this. This will definitely come up on your comprehensive exams, your CPCE. We can talk more about that in class. But the definition is a professional relationship, right? You're not just kikiing with a friend. It's a professional relationship that empowers diverse individuals. Diversity is very important to the counseling profession, being able to work with all walks of life. So, diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. And the reason I've bolded wellness is because we are on a wellness model. Counseling is based on a wellness model, whereas psychology and psychiatry, that's on a sickness model, a medical model. And so it's looking at what's wrong with you, how do we treat these symptoms, and how do we diagnose and that kind of thing. And we still do diagnose as counselors, especially mental health counselors, school counselors, not so much. But all counselors should operate from a wellness model. And then career is highlighted because, like I said earlier, the birth of counseling kind of came from that industrial revolution where people had to figure out what to do with their lives, how to make money, how to support their families. So we look at the comparison of different mental health professionals, and we'll get to school counselors as well. So, clinical mental health counselors usually have a master's degree in counseling. They can be found in many settings, like the schools. You wouldn't necessarily be a school counselor, but you can be a school-based clinical mental health counselor. You can work in an addictions facility, inpatient or outpatient, a psychiatric hospital. You can work in private practice with couples. I work with couples and individuals, and I do some family sessions too when my individuals want to pull in other members of their family. So you got to know how to do that too. And then rehabilitation counselors. And I don't have as much experience with this, but Dr. Lusk, she has her degree and does her research on rehab counseling. She does consultation work with it. So if you're interested in rehab counseling, like getting people back to work after they've become injured or disabled, helping them live full functional lives, Dr. Lusk would be your resource for that. And you can become licensed by states as a licensed professional counselor. So school counselors hold a master's degree in counseling. Your specialty is school counseling. Your professional association is going to be the American School Counselor Association, or ASCA. You're going to hear ASCA referred to a lot in this program. It disaffiliated from the American Counseling Association, which you should all belong to. You're going to have to join the ACA by the time you get to practicum for your student insurance, like liability insurance. But so ACA used to be this broad umbrella, but ASCA and the AMCA, which is the mental health version of ASCA, they both disaffiliated around 2018, 2019. So you can become an NCC, which is a nationally certified counselor. ASCA has certified school counselors. There's national certified school counselors, and you can also become an LPC with additional coursework. But we have our program set up where you can graduate and kind of go either way. You can become an LPC, or go to the certified school counseling route. So it gives you some options. Um, and sort of the same things with clinical mental health counselors, right? AMCA, American Mental Health Counseling Association, that's your specialized association that you would belong to. And like I said earlier, it disaffiliated from the American Counseling Association. I think it had to do with logistics, money. I really don't know. Leadership. I don't know. Um, but that's AMCA. And that's a really good conference. I've been to that. And I've heard ASCA is a great conference as well. Dr. Bledsoe, she specializes in school counseling. Also, Dr. Burgess specializes in it. So those would be your resources to ask more about ASCA. And, clinical mental health counselors often become NCCs, nationally certified counselors, and LPCs, licensed professional counselors. And you've got to get your LPC to bill insurance. So that's a necessity. That's not optional. All right, so marriage, couple, and family counselors. There are programs that are just specific to marriage, couples, and families. I teach the family class, and I also work with couples, and I have the same degree that y'all are going to get, mental health counselors. And so while there are people who specialize in this, that doesn't mean you can't do it with this degree. Um, Some associations you might want to belong to would be the AAMFT, American Association of Family Marriage and Family Therapists, and then the international version of that as well. That's a division of ACA. Remember, I talked about ACA as this kind of umbrella um, association. You can also become an NCC with additional coursework, and they're usually LPCs, and they have their own licensures, just depending on what state you're in. All right, so college and student affairs counselors. So we don't have a track that specializes in that. Some counseling programs do, but that doesn't mean you might not be able to do that with this degree once you get out. You can certainly work in a university counseling center, but there are other roles that you could have as well. Of course, you're working with students, college students, maybe in the Career Center, the University Counseling Center, Residence Life, things like that. Everything, all things higher ed, helping college students get through it and thrive. So professional associations, I've got listed here. I won't read those off to you, but I have attended one of these conferences and it was really small and everyone was really warm and friendly. I mean, I've not been to a conference that I didn't like. So if you've got any questions about this, I'm happy to talk to you about it. And also, Dr. Wawees McCormick would be a good resource if you're interested in working with college students. Um, She's the director of the University Counseling Center, and you'll have some interact. She also oversees COPE, so you'll have interactions with her. All right, addictions counselors. Now, again, there are specialized programs for this, but you can graduate with this degree and work with addictions. We've got Oxford Treatment Center as one of the most well-known one around here that people usually work with. You work with all kinds of different addiction disorders, not only drugs and alcohols, but then there's also eating disorders and process addictions like sexual addiction, gambling, things like that. Here are your professional associations that you can see here. One of them is a division of ACA, so that's pretty cool. You can also get extra credentials like the MAC, it's the Master's Addictions Counselor, and that would be post graduation, so you could work on that. And again, NCC, which most people get, it's just sometimes it gets you a pay bump, sometimes, and it just shows that you're, highly credentialed and trained. And then also licensed professional counselor, usually for addictions. And then I touched on this earlier, rehab and clinical rehabilitation counselors. They often serve people with physical, emotional, and developmental disabilities. They also work with state vocational rehab agencies, unemployment offices, private agencies. Here are your professional associations listed out below, as you can see on the slides. And you can also become a CRC, certified rehab counselor. So again, like I said, if you're interested in working with this population and doing this kind of work, talk to Dr. Lusk because she's the expert on this kind of thing. And then there's pastoral counselors, and they have their own degrees. So you can be a counselor who is a Christian, right? There's nothing wrong with that. And if you have clients that come in and they want to talk about their faith, they want to use prayer as coping, they want to look at their life through the lens of Christianity, through the Lord, and all of that. That is totally fine, but you cannot be a Christian counselor. Like you can be a counselor who is Christian, right? And incorporate it where appropriate, but you cannot just go in and blanket proselytize to all your clients because that would be imposing your own values on your clients. So it's a fine line of, walking that of where do you see that fits best. So this is not we don't offer that track here. You would go to a seminary or something like that. But that doesn't mean that if you're a Christian and you're in this program becoming a counselor that you have to abandon all that because there are some agencies around here that are Christian counseling agencies and they practice ethically. Not everybody that goes to counseling there is a Christian and they don't force those values upon those people. They treat them, as they would just any counselor would. So, but then there are some people that they know, okay, Cornerstone, right? Cornerstone is a Christian. They have a lot of Christian counseling practices, faith-based. So they may gravitate towards that because they know that there will be people there who can walk them through their struggles through that lens, right? So if you have questions about this, happy to talk about it, but it's important to know you cannot be forcing your values on other people, but you don't have to abandon them either. So, um, they might be eligible to be NCCs and LPCs depending on the degree, right? So, just depending if it's accredited and things like that. And then, okay, so those are all the different types of counselors that, kind of are out there. Now we're going to look at how is counseling different from other professions. So we've got social workers. All right, we'll start there. We have a social work program here on campus, even. You can practice as a social worker with a bachelor's. A lot of people go for that master's. You can't do as much with a bachelor's, obviously. With a master's, you can become a master's level clinical social worker, and they can do everything a counselor can do. They can bill, they can offer the same interventions. They just have different training. They train more on a macro level. They look at, what are the social injustices that a person is dealing with, what are the systems that are oppressing them, and how do we kind of help them navigate those systems. And again, counselors do some of that stuff too. So it's nuanced. It's nuanced. But we do a lot of the same things. And again, clients don't really care, right? They just want help. But it's important for you to know that you're not a social worker. Okay. The Professional Association for Social Workers, all to be considered a profession, you've got to have sort of an organized association affiliated with an association. So theirs is the National Association of Social Workers. You can become nationally certified by the Academy of Certified Social Workers and become licensed as a clinical social worker. But that's not what we're here to do. That's what they do over there in social work. I know it gets confusing sometimes. All right, the other helping professional that you'll probably collaborate with is psychologists. And psychologists, you have to have a PhD to practice and bill. They can offer a lot of the same services that counselors do. They come from more of a medical model, but they do have some approaches like positive psychology, that looks a lot like the wellness model as well. So again, it can get confusing. I'm sure all your family will say, "How's your psychology degree going?" But you're not getting a psychology degree. You're not becoming a psychologist. Um, they work in a variety of settings, similar to clinical mental health practitioners, different agencies, maybe private practice, HMOs, universities, businesses, prisons, schools, and it's very similar to where clinical mental health counselors can work. There's different types. There's counseling psychology, which is kind of gets confused with us a lot. Then there's also clinical psychology, which is more kind of on the hospitalization side, the more severe disorders. School psychologists, they do a lot of testing. Psychometry is what that's called. And there's industrial and organizational psychologists, and they kind of help corporations like businesses kind of structure their employees' experiences and things like that, or like help them increase their profit, marketing and things like that. So there's different kind of psychology, but that's not counseling. And they've got their own professional association, which gets confusing because we use their handbook for all of our papers, but it's the American Psychological Association. That is that made their umbrella professional organization, and they have lots of different divisions like the ACA does too. All states offer licensure as clinical psychologists, counseling psychologists, or both. And many states with these allow with a PsyD. So you really need a PhD. You need a doctorate, and most people get a PhD. Some people get a PsyD. So I don't really, we're not doing that. So you really don't need to know the ins and outs of that. But if you're interested, look that one up. Um, and so I think I've said all I need to say about psychologists. Some states they can prescribe medicine. That's very, very rare. It might be one or two, but psychologists typically do not prescribe medicine. The psychiatrists do. So that brings us to psychiatrists. A psychiatrist is a medical doctor who goes to medical school and then they specialize in psychiatry. So they are not getting trained in these theories and these interventions, these helping interventions. They are looking at the medical piece of it and they're prescribing medicines, and you're going to work with a psychiatrist. You need to have a good psychiatrist or a psychiatric nurse practitioner that you can refer to when you're working with clients and students and things like that. Um, so they're just like any other medical doctor. They've got to be board certified. They have their expertise in diagnoses and treatment of psychopathology and prescribing medicine. Um, that's almost exclusively what they can do because there's, like I said, psychologists, they might be able to prescribe it in Louisiana. I don't know, but psychiatrists, when you think meds, think psychiatry. And their association is the American Psychiatric Association. And then we've got psychoanalysts. They have training in psychoanalysis from recognized psychoanalytic institutes. So you might go to a Jungian institute. You'll learn about this in theories, but this is just like a very specialized training. Um, General need as a graduate degree, but I don't know any programs that are in psychoanalysis. This is just sort of a niche that you can specialize in. They've got their own professional association, as you can see, and most states don't offer a license in this. So, you know, it's just, I think if you're a counselor and you're interested in psychoanalysis, you can get trained in it and become certified and credentialed in it, but there aren't any programs for that kind of thing. And then lastly, psychiatric mental health nurses. And so they're trained as medical professionals. They're also skilled in delivering mental health services, and they can prescribe medicine. You might hear them referred to as psychiatric nurse practitioners. Um, and they've got their own professional association, as you can see there. Most of them work in hospital settings or clinic settings, things like that. There's two levels. You can be an RN or an advanced practice registered nurse with a master's degree. And then they've got prescription privileges in all 50 states. So again, you need to get familiar and friendly with somebody in your community that you can refer out to if you feel like somebody that you're working with needs medication. And then creative, I guess not lastly, we've got creative and expressive therapists. Again, I don't think there are many programs particular to this. I've had people inquire about that and we've looked it up together. I think there's one like really expensive one that you could apply to, but it's not accredited. But I would say, you're in a CACREP accredited program. If you are a creative type of person, there are different trainings, you can do. There is an American Counseling Association has a division dedicated to expressive arts or creativity and counseling, I think is the name of it. So it's just, if you're into the creative arts like dance and poetry and acting, improv, those kind of things, you can certainly infuse that into your practice once you get good at the basics, right? But that's not something that is really credentialed or licensed. And then human service practitioners. So these are generally like bachelor level, like case management type thing. They have an associate's degree or bachelor's. They've got their own association there. Entry level support and counseling roles. When I was a counselor, I had a case manager. She's bachelor's level, and she ran around and knew all of the clients that I knew, and she helped me, and she would make sure that they got to their doctor's appointments and facilitated, those kind of social work type needs. So, um, psychotherapist, we've just kind of talked about that. Not associated with any particular field. It's just sort of an interchangeable term. Anyone can call themselves a psychotherapist, but only licensed practitioners like counselors, social workers, and psychologists can practice psychotherapy. So, um, I'm curious what questions you have. I look forward to talking with you in class about what a counselor is, what you think of when you hear counseling, when you imagine yourself as a counselor. So be thinking of that. We'll talk about that and any questions that you have regarding this chapter. I'm happy to answer that. I do have a couple of reminders and to-dos. Make sure you read chapter 2 for this week and complete the quiz. The quiz will cover both chapters 1 and 2 and write a reflection covering chapters 1 and 2. It just has to be about a page long, double spaced. And we'll talk about that assignment in class. Don't forget to complete the syllabus quiz. It's due the second week of class, and you can take it as many times as you need to get it right. And then start looking at scheduling an interview with a counselor because that's one of your assignments. It's due in about 6 weeks. And so people, they're they're pressed for time. So go ahead and start trying to get on somebody's books. And we'll talk about this in class. So I appreciate you bearing with me on this. It's my first time to do one of these, like I said. So see you in class.